The philosopher Soren Kierkegaard said, "Life can only be understood backwards, but it must be lived forwards." To me, that means that we have to pay attention to our history, learn from it, and then move forward with those lessons in mind. Community elders have traditionally played a major role in helping younger generations learn the lessons of history so they can use that knowledge in advancing the well-being of society. But once in a while, there is a person who is both an elder and a community activist who can combine the looking backwards and moving forward. One of those unique individuals in the American Indian community is Norby Blake. She has a remarkable history and she continues to be a positive force in her community. We'll be talking with her on today's episode of A Public Health Journal.
Welcome to A Public Health Journal, a program that explores the public health issues facing our society today and tomorrow. The host of our show is Dr. Ed Ellinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health, the Hennepin County Human Services and Public Health Department, and the Minnesota Public Health Association, all working together towards the goal of healthy people living and thriving in healthy communities.
Welcome to A Public Health Journal. Today we're going to have a conversation with Norby Blake, an elder and leader in the American Indian community in Minnesota. She was born on the White Earth Reservation. Her great-grandfather was Chief Hole in the Day. She was a strong presence in the development of the American Indian movement and worked as a healthcare outreach worker for Fairview Hospital. She was a major force in the establishment of the Indian Health Board in Minneapolis and was involved with the establishment of the Indian Child Welfare Act. She has also worked for the Minnesota Department of Human Services as their first American Indian mental health tribal liaison and also worked for Hennepin County. Although she states that she has retired 3 times, it's hard to find a time when she was not actively working to improve the lives of American Indians in Minnesota. Her impact on the state has been impressive, so it's an honor to have her on A Public Health Journal to talk about where the American Indian community has come from and where it is going. Norby, welcome to our program.
Hello.
Thank you for taking the time to be with us. And just looking back on your history, you've been a community activist and doing a lot of community activities for all of your life. How did that get started? Where did that come from?
Well, I was thinking about that one day, and I thought, well, I believe that came from the fact that I was brought up with my mom and my father, and along with my siblings. But what happened during this was in the early 30s. I was born in 1932. So, there was, it was probably, I would say, maybe during the Depression years. But being raised with my mom and my father and all my siblings, my mom and father spoke fluent Ojibwe and English. You know, they all went to, my mother had been to boarding school, and then my father, he had his schooling elsewhere out east somewhere. And anyway, they went to visit, we used to call them the old people in the community. We didn't call them elders or anything, we called them old people. And so my mom and dad both took turns, or maybe sometimes both together, would go and visit the elders. And sometimes, as I became older, I would tail along with them, you know, and wanted to follow my dad wherever he went. And so he helped write letters for the people that spoke fluent Ojibwe and had problems with the English language. And so he helped with that and helped them with writing their grocery list, helping them get to the clinics. You know, there was only one hospital at White Earth, and I don't know if there's a clinic right now, but there was 3 public health hospitals, and one was in the White Earth Reservation, which is one of the 3 largest reservations, and Leech Lake and Red Lake. And so my father had access, I mean, he was always driving all over, and I do that to this day. I drive all over. So he helped people get to the clinic and get to the hospital and take them to the grocery stores. And my mom also. My mom was involved with, like all the women on the reservation, they helped make quilts and did helping of raising the grandchildren and the children, and also helping to just teach the kids what to do and how to do it.
Did you get a sense that they were really having a huge impact on your community?
Well, I think that not only my mom and dad, but many of the other people that were able to do this did the very same thing. Yeah, but my mom and dad were well acquainted in the community as well. And
so one of the things that you mentioned, that your mom was, or your dad was in boarding, or your mom was in boarding school.
My mom was
and
in
I
boarding
know,
school.
you know, we
at
deal with this whole
Pipestone.
idea of historical trauma among American Indians with all of the things that happened. What did you learn from your mom about the boarding school issue, and how does that play out today when you're dealing with communities you're still dealing with some of that historical trauma?
I just assumed that my mom it was very traumatic for her. What I learned was that she was raised in a boarding school due to the fact that her mom had died as a young child. Her mom died. And so she died of tuberculosis. And my mom's father couldn't raise the children all by himself. And so the children were transferred to the boarding schools. And my mom attended the Pipestone boarding school. And then I think in some ways that it was traumatic for her.
Did she talk about it?
That's what I was going to say. She never talked about it. I'd always ask her about, what happened, Mom, about this? And she'd start out a little bit telling me about this, and then she'd say, oh, well, that's enough now. You better go out and play, or go help your dad, or, you know, play with your sisters or something. But she never wanted to discuss it anymore, you know. And so as a child growing up, I understood that. And
So how did you take all of the stuff that you learned from your parents and your community off the reservation into the state of Minnesota? Because you've been engaged in a whole number of things.
I know.
How did you kind of take that out into the world?
Well, there was nothing left for me to go to. My father died when I was in high school, and I was very close to my parents, and my father in particular, and he always accompanied him because of a hearing loss he had in one of his ears, his right ear. And it happened in these early days growing up, and I never did get the whole story of it, about it, but only the fact that he was run over by a horse and buggy, you know, and when he was a kid. And so as a kid growing up without, you know, they didn't have hearing aids or doctors with, you know, that education on the reservation that we could go to. So my mom and I was going to say they used traditional medicine as well as the regular Indian Health Service physicians. And so I was brought up with both of those in our family. We had, she was called Grandma, and to us, and you called different elders in the community Grandma and Grandpa. I mean, it was, and it was raised. We were raised like a small community, and everybody knowing everyone else, and helping. It's so much different than it is today, you know, and it was a freer time and a whole family togetherness more than it is today. And so my mom and dad helped not only their closest neighbors, but all around the community as much as they could. And my mom never drove a car. My dad drove a car all the time. And so I always meant that I wanted to follow along. And so I learned to drive because I didn't have schools for driving, teaching driving when I was growing up. And so I learned to drive by watching him. And so when he died, you know, it really was traumatic for us because my father was head of household in every sense of the word. And my mom was, you know, she'd always say, ask your father, you know. And but they always seemed to communicate very well. He was 10 years older than my mom, and I think that a lot of times, you know, he did all of the things. He took care of our money issues. He took care of our shopping, and all of that. We all were. They were both raised Catholic, and so we attended the Catholic church and schooling in the White Earth Reservation.
I want to get at some of the things that you've talked about, the American Indian Movement, the Indian Health Board, the Indian
okay.
Child Welfare Act,
Yes.
but so I'm going to get to that, but we have a little video that you have brought that actually kind of goes through some of your life, which I think puts it in perspective, which I think will set the stage for some of the conversations we'll have after this video. So let's roll this little video about Norby and some of the things that she's done.
Okay. Hey, America, wake up. Over 40 years ago, when there were no health services for urban Native people in Minneapolis, a small group of us organized. We listened to everyone's stories to better understand our community's needs. We wrote grants and even hung drywall to build the first urban health clinic in the United States. Today, the Indian Health Board of Minneapolis provides medical, dental care, and counseling to 7,000 clients annually. Together, we did it. For all my life, I have been a community organizer and advocate for Native people in the Twin Cities and the state of Minnesota. I was always fortunate. I've never collected unemployment, and I loved all the positions I worked in. Over 10 years ago, at the age of 73, I remember coming out of retirement for the second time. People called me at home often to talk about their concerns. I'd think to myself, Norby, what more can you do to help your community? In 2004, I applied to the Family Health Services, a nonprofit agency in Minneapolis. My job was to help reignite their Native Elder Services program and to look for monies. We met in a local church. People were curious and started showing up. We began to meet weekly for lunch. Eventually, we also beaded and we made quilts and played bingo together. They used to call us the Grandma's Group, although Grandpas were welcome too. As we built trust and got to know each other, our conversations got deeper. We began to talk about more complex and sensitive issues. Pretty soon, we found speakers to talk to us about different things. We also found an attorney and social workers to help us navigate through the system, paperwork, and find us appropriate resources. We even found volunteers to help us thread our quilting needles. But finding dollars to keep our elder program going was the hardest thing we faced. I think those who oversee state and federal dollars, as well as foundation monies, don't understand Native elders and families, perhaps because we have different values. As Native people, we don't tell our children it's time to move out when they turn 18, especially because we know how hard it is to survive in the city when there are no jobs or affordable housing. We are generous with what we have, even though we might not have enough. As Native elders, most of us don't spend our golden years away from home golfing at seaside resorts or sitting in nursing homes. Instead, we choose to help in nation building. We spend our time and energy strengthening the spiritual and cultural fabric of our people. As Native people, we have a longer view. Our life savings are our children and grandchildren, not just retirement funds sitting in pensions or 401k accounts. We know the survival of our unique languages, values, and teachings lie within our future generations, and we must live in a good way amongst them. As Anishinaabe, we live by our 7 grandfather teachings. We feel pride in who we are, and we must live our lives in Minnow Bimadaziwen. At one time, we had a village to help raise, feed, and clothe our children and grandchildren. Today, times have changed, but we still need a village. A village that will not only help raise the children, but also support the elders who are raising our children and grandchildren. Yes, it might be difficult to stay up late with our grandchildren or learn how to work on computers, but we can do it if it means passing on our beautiful teachings. We learn from each other. Both grandchildren and grandparents are true blessings. We need more state, federal, and local agencies, health providers, and caseworkers to better understand and respect our elders. Sometimes I don't think they sit down long enough to really listen. My relatives, it's time to raise our voices and tell our stories. We need to take a stand, like some of our children and grandchildren did during the American Indian movement. Maybe we need to start a Native Elders movement. Hey America, wake up. We're still here. We still need homes, food, jobs, and clothing. We need well-funded elder wellness programs and behavioral health services. We also need to bring awareness about elder abuse and make sure our elders are not being exploited. We need to assist grandma and grandpa groups living in every city, reservation, and village because we know how to reignite programs, organize, and help find solutions. My name is Norby Blake. I am Mindy Muya, meaning old woman, a Bear Clan mother and an enrolled member of the White Earth Reservation. In 2011, 5 years ago, I finally retired for the third time, but I'm still very active in the Twin Cities. I am an ornery advisor to the Indian Health Board, a PCA patient care assistant for a family member, and a member of the local Native Elders group, which meets every other month. Remember, we can do it together. Me Gwetch.
Welcome back. I am honored to be with Norby Blake, talking about her role in the American Indian community and in the broader community. And Norby, we have just a little bit of time on this program. I wish it was to be longer, but I want to talk about a couple of things in particular. You were involved in the Indian Health Board. Tell us about why the Indian Health Board got started, what your role was in that, and sort of the impact that the Indian Health Board has had in Minnesota.
Well, it was during the civil rights era, and the Black community was involved in their community and developing their programs, and so along with the community of the American Indian community, we decided that we have to have a voice in what's going on in our community today. And it was not a community made up of too many people at that time. There were just, few people and a few organizations. But we felt that there needed to be schooling, we needed to be education, there needed to be housing, there needed to be health care, and all of the social services that go along with those areas. But what we did was look at the group. Some of us just separated and went into the various, like housing and education. We went into the housing, and we went into the health care. And we felt that there were no health care clinics set aside for Native people. And the hospitals that the people went to were just, they went to them because they did have no choice, and they only went to them out of necessity. And if they were involved in a car accident, if they were having a heart attack, or if they were like diabetes or some of the other issues that are there. But that was the only reason. And so we wanted to make sure that people had a place to come to that recognized and appreciated who they are as a people, and to help them to get acquainted with health care and not be afraid to go in and see a doctor or a nurse or a health physician before it was too late, and take care of their families, because everyone wants to have a healthy child, a healthy neighborhood, a healthy community. And so that's one of the reasons why we thought a health clinic would be so important for us.
And it is now.
It's
an established part of the Phillips neighborhood.
It's been
what kind of impact has it had?
It has had a very huge impact on our community, because there were more. We only had one physician to begin with, and so now We have clinics now on every reservation. We have health care. There's two community clinics in the Minneapolis area. And the health board that I was a member of, and it was just amazing how quickly that grew. You know, they looked at the care of heart problems. Many of our people were just die because they didn't want to go into, and they didn't understand the symptoms. So they just
It's made a huge difference.
made a wonderful.
Yeah. Now, also, the
impact.
Indian Child Welfare Act, that has sort of national implications. Tell us a little
Yes.
bit about that.
Well, in working with, before I became involved with the health coverage, I was involved with Charlie Deegan, who actually was a part of the Indian Health Board too, and he had a very important impact he played in that. But anyway, the children and the mothers, families were being, their children were being lost to the families and being forced into foster placement at a very high rate, and by Hennepin County in the reservations, the counties adjoining the reservations. It was so pitiful and so sad. There was many times when our program would end up in tears listening to the stories, and many of them had no idea what it meant to have their children removed, and termination started, and the children going into foster placement, and the children growing up today and having been in foster placement will tell you that they thought they had done something wrong, and that had been the reason why they were removed from their family.
It's almost like the boarding school that your mom
Exactly. Yeah.
experienced when she was a child.
Yes.
And so what does the Indian Child Welfare Act do?
What it does is we created it. We worked with many of the attorneys, and the legal rights played a big role in that. So we all got together and talked about, and had some of the parents come in, and so we had some issues, and we had an attorney from South Dakota. I can't remember what his name is right now, but he was very important. And so we put together some legislation, and some people went to Washington on that. Some people went to just with their own legislative people in the communities, and so it became very. Everybody went and told their story into the Washington.
Yeah. Has it made a difference?
Oh, definitely. It was a federal issue and a federal law that came into place.
Because that raises the issue that the tribes are really sovereign nations, and they,
Yes.
Yes. How does that impact how they work with like the state?
It was difficult at a time, because they couldn't understand why, what was happening. I suppose they thought they were doing something good, and taking the children out of the situation where mom and dad, or mom, if she was it was a single family, a single parent. There was no father, or maybe there was no mother. So I think what happened was they wanted to remain together, and they couldn't understand why all of this was taking place. So it was important for people like ourselves to get together and it was called the Indian Child Welfare, but not only on the federal level, because other tribes from other reservations throughout the nation also recognized that. And so they started working in their communities and doing the very thing that we were trying to do. Mm-hmm. And then it became a state action. So now we have the Minnesota Child Welfare Act as well. And so what it's done now is created a place for many of our young parents to understand more about the law, and they understand more about their children learning to go into education, become attorneys, working in the court system, working with child welfare, going to school to become social workers and helping
So
to
you've
keep
got
their children.
you've got lots of stories, and I wish we had more time to go through some of those stories. But I mean, thank you. We're running out of time.
And
I want to make sure that we highlight the fact that that video that was put together by DigiDreams Production,
Yes.
which is really nice video. So that was very nice. And thank you for all of the work that you've done. And I hope I can find some time to sit around a kitchen table and have a cup of coffee and share some more stories. So Norby, thank you for all your work. And I'll be back with a closing comment right after this message.
Hey, you.
Yeah, you. Getting that college education.
What are you gonna do? Graduate and take some office job?
Be like everybody else.
Or will you dare do something different?
Like, be a teacher. You could be my teacher.
You got the skills, the smarts.
Yes, you.
You could be the teacher I never forget.
That'd be cool.
Does that corporate job even have recess?
What are you gonna make of yourself?
What are you gonna make of me?
Today's program was really about stories, and we had a great storyteller. As I listened, I was reminded of a passage from Leslie Marmon Silko's novel Ceremony. She wrote, "I will tell you something about stories. They aren't just entertainment. Don't be fooled. They are all we have, you see, all we have to fight off illness and death. You don't have anything if you don't have the stories." I have learned that storytelling is one of the most effective ways to learn about and address many of the individual attitudes, beliefs, and behaviors that ultimately affect health. Listening to the stories of patients is incredibly important in the process of creating health. And stories can also be used to educate the providers themselves. Stories can be an effective tool in a non-clinical situation to influence public policy and public health. Sharing stories with legislators and other policymakers often has a greater impact than our research-based charts and graphs. Stories can help community groups identify with health and social justice issues in their neighborhoods and stimulate action to confront those issues. And stories can be helpful in raising issues and advancing conversations among colleagues when used in newsletters, magazines, and journals. Our technologies and medicines are extremely powerful in treating disease and injury, but they are nearly useless in dealing with many of the attitudes, beliefs, and behaviors that play a major role in determining the status of our individual health and the health of our communities. These are influenced more by the everyday experiences with families, friends, community, the media, religious institutions, and schools. Ultimately, stories, in various forms, may be the only way to modify those influences. Only when we can effectively incorporate our medical expertise with our human stories will we be able to optimally enhance the health of patients and the communities in which they live. I encourage you to become aware of the stories in your life and honor the telling of those stories whenever and wherever you can, because in the end, they are all we have to fight off illness and death. Norby Blake has shown us the power of story. It is true, you don't have anything if you don't have the stories. That's all for today. Thanks for watching, and hope you can join us again next time on A Public Health Journal.